My patient is a 49-year-old female who received right total knee replacement without cement, which is typically recommended for younger patients with end-stage osteoarthritis. Her surgery was bicompartmental, which means that the whole femoral and tibial surfaces were replaced. The patient will demonstrate weakness of knee extensors and flexors along with decreased range of motion accompanied by pain. The patient is weight bearing as tolerated on auxiliary crutches. She is 7 weeks post-op with a range of motion of 10 to 85 degrees of knee flexion. She is just beginning the moderate protection phase of therapy with a pain level of 3 out of 10. Her short-term goals are to increase range of motion to 0 to 95 degrees of knee flexion within 2 weeks and to ambulate with 1 auxiliary crutch instead of 2 by the end of 2 weeks. The plan of care to address these goals includes therapeutic exercises, therapeutic activities, gait training, modalities as needed, and neuromuscular re-education. The patient was advised by the physician to avoid contact sports, jumping, or sideways movement in a sport such as skiing. Hi Rhonda, my name is Melissa. I'm a student physical therapist assistant at South University. I'm going to be working with you today on your knee.
Okay.
If you feel any increase in pain, please let me know and we can stop. Also, is it okay to proceed with the treatment?
Sure.
Good. And one more question. Do you have any fevers, any recent fractures, any other medical history that I need to know about?
No changes.
Good. And on a scale of 0 to 10, 0 being you have no pain, 10 being you have to go to the emergency room right now, where would you think you're at?
I'd say around a 3.
Around a 3 out of 10?
Mm-hmm.
Okay, very good. And how do you feel after your last treatment?
Well, I just can't get my knee straight.
You can't get it completely straight? Okay, well we're going to be working on that today to improve that, okay?
Okay.
We're going to take the range of motion of your knee now to see where you're at compared to that last treatment, okay?
Okay.
So I got the goniometer, greater trochanter, lateral epicondo, lateral malleolus. Okay, so go ahead and push that knee down into the mat as much as you can. Good, so we're at 10 degrees. So now we're gonna go ahead and bend that knee as much as you can. All right, perfect, 85 degrees.
Okay.
So your range of motion is 10 to 85 degrees of right knee flexion. So I'm gonna test the strength of your quads, this muscle right here. Okay, so first I want you to have you bring your leg up as far as you can and back down. Okay, so you're good through gravity. Okay, so let's try a little resistance on it. So go ahead and bring your leg up as far as you can and unlock it. You're gonna unlock your knee a little bit, so bring it down a little bit for me. Hold it there, don't let me move it. Okay, good. So she couldn't withstand any resistance, so she was a 3 out of 5 on the muscle test. We're going to do the timed up and go test for you. So once I say go, you're going to get up safely on your crutches. You're going to walk down to this red piece. You're gonna walk, you're gonna turn and come back, and you're gonna sit back down. Okay, so the red piece is about 3 meters away. And I'm gonna be timing you the whole time, okay? To compare to that initial eval. Okay, are you ready?
Yeah.
Ready, go. Put as much weight into that right leg as possible. Good job. As soon as your butt hits that seat, time stops. Okay. Good job, that was 28 seconds.
Right.
So that was the first round. We would actually do it 3 times and average your time. But out of the 3, it is better than the first time that you did it at your initial eval.
Okay.
So for this first exercise, it's called heel slides. It's going to increase the range of motion of your knee and also strengthen the muscles that are behind and on top of your leg. So first we'll use a nice clean pillowcase. So go ahead and lift that foot for me. Very good. Okay, so now you're gonna bring your heel as close to your butt as you can and then straighten it out as much as you can afterwards. Very slow and controlled. Good. Go through. So for this one, we wanna do 3 sets of 10, okay?
Okay.
And again, keep it nice and slow and controlled. And one more we'll do. Good. I'll take this pillowcase and go put it in the linen. So, Rhonda, for this second exercise, it's called a prone hang.
Okay.
So we need that right knee all the way off the table. Make sure to slide off a little bit more. Perfect.
Okay.
All right, and I'm gonna put this 2-pound weight that I just cleaned on this ankle. Nice and snug. Okay, now you're just gonna hang out here for about a minute. Let that leg relax and let the weight pull it a little bit into complete straightness. This is to increase that range of motion to try to get that knee completely straight as one of your goals
Okay.
states.
All right.
And so you'll hang out here for a minute and we'll
Yes.
do that about 4 times.
Okay.
How does it feel?
Good.
Good?
Feels good.
Now this third exercise is called bridges. So this one, you're gonna bring your butt off the table. You can use your arms and you're gonna dig in through your heels as much as you can. This one is to strengthen a couple muscles back here in the back of your leg. And also make sure that core stays nice and tight to hold that position.
Okay.
Okay, so we're gonna go up best you can. Good, make sure you're digging in through those heels.
Okay.
Slow and controlled, up, hold for a couple seconds, and back down. Good. How's that feel?
Good.
Good?
Feels really good.
Okay, so that one, again, you would do 3 sets of 10, just like the other. This functional activity,
Mhm.
we're going to be switching your weight from one foot to the other.
Okay.
You're gonna keep them as close, like shoulder width apart. So you're just gonna stand here and you're going to shift.
Okay.
And you're gonna do that holding on to the bars. Okay, so go ahead and stand up. All right, so, nope, you can stay this way.
Okay.
There we go. So first, you can shift onto your right leg. Make sure you're squeezing this muscle as much as you can, okay?
All right.
And you're gonna put as
Squeezing.
much weight into your right leg as possible without pain. And this is just to improve the weight tolerance of your right leg and the walking abilities with your crutches.
Okay.
So we can try to get you to that 1 crutch goal. How does it feel?
Feels good.
Good. Okay. Now this is your home exercise program.
Thank you.
So first on here is a long arc quads, it's called. So we're gonna sit on the edge here,
Okay.
and you're just gonna bring your leg up and straighten it as far as you can, and back down. Okay. So that will be 3 sets of 10 every day. The next one is gonna be the hamstring curls. So as you can see here in the picture, you're just laying on your stomach, and you're gonna bring that heel all the way to your butt,
Okay.
just like he is. Okay, as far as you can. Again, 3 sets of 10 every day.
Okay.
Okay, and the last one is what we did today, the prone hang. That's where you're gonna make sure your knee is all the way off the mat and just let that foot hang.
Okay.
Okay?
All right.
All right. Any questions?
No.
Good. Rhonda, I'd like to talk to you a little bit more about your knee surgery that you've had. Just so you know, it is very important to get that knee completely straight like we're working on, and
Okay.
also to get it bent to about 95 degrees to prevent those contractures from happening.
Okay.
And also you want to get off those crutches as soon as possible to get back to your normal walking pattern that you had before the surgery. And one more important thing I'm sure you already know, keep the knee moving and keep the ankles moving to prevent any blood clots from forming.
All right.
And also, according to your physician, he said no sports, no contact sports, no jumping, and no lateral sport movement such as skiing.
Okay.
Okay. You received a non-cemented knee replacement. So
Yes.
that's very popular in the younger population, according to a journal article that I found. And also some suggestions for home. So if you feel any pain, you are allowed to use ice for about 10 to 15 minutes as needed. And also don't put any pillows underneath that knee because you want to try and get it as straight as possible.
Okay.
Okay. Any other questions?
No, that's it. Thanks.
Good. It was a pleasure having you today.
Thank you.